Dr. George Landis, board certified plastic surgeon. I'd like to let you know what you can expect for your tummy tuck recovery. A tummy tuck is a common plastic surgery procedure. It's remained popular over the years, one of the most common procedures I do in my practice. In fact, the most recent statistics from the American Society of Plastic Surgeons show that it's one of the top 5 cosmetic procedures performed for men and women last year. So, despite the popularity of this procedure, many people don't know what to expect from the recovery. And understanding your recovery process and the timeline can make the tummy tuck an easier journey for you. Now, recovery times vary. There's no single answer for how long it will take to recover from a tummy tuck. Like any procedure, there's a general time frame, but individual recoveries are based on a variety of factors, including your age, general health, type of tummy tuck you had, post-surgery care. And after the procedure is complete, your surgeon will discuss a more specific timeline for recovery, but generally speaking, most patients begin feeling normal about the 8-week mark. Why the type of tummy tuck matters? Well, there are several types of tummy tucks that can be performed. You can get a full or more involved extended tummy tuck, or you can get a mini tummy tuck, which only focuses on that small area in the lower abdomen below the belly button. The more extensive your abdominal contouring is, the longer it may take to recover fully. And this is especially true if you opt in for an extended tummy tuck, because it involves the flanks, the lower back, and lower chest. Okay, so what to expect during your tummy tuck recovery? The most important thing to remember during this process is to follow your surgeon's instructions closely. And don't hesitate to contact the doctor's office if you have questions or concerns. Now, choosing a board-certified plastic surgeon for your tummy tuck is always recommended because he or she has met stringent training and safety requirements that other surgeons have not. And your board-certified plastic surgeon can offer recovery advice and assistance during the healing process. All right, let's look at the stages. First, immediately after surgery, well, directly following a tummy tuck, your abdomen will be covered with surgical dressing. And in many cases, there will be a thin, small tubes placed around your incision in order to drain any fluid that builds up around it. This is most common, and it shouldn't cause you any discomfort. You'll need to rest at an angle for the first few days of recovery, and you'll be given instructions to move about. That is to walk around quite a bit to help prevent any blood clots in your legs that would go to your lungs. Now, when you're home, it's important to line up help for at least the first day or two that you're home following surgery. You'll be prescribed pain medications, you have limited mobility, so you're not going to be able to drive yourself home, and you'll need to have someone stay with you that night. Now, once you're home, you'll have some difficulty bending, certainly lifting, and standing for prolonged periods of time. So having someone to help around the house during the initial period after tummy tuck surgery always makes recovery much easier. Now, for your daily maintenance, your doctor will teach you how to properly care for your incision and those drainage tubes for the duration of your recovery. Many patients are given antibiotics and sometimes blood thinners to take for a certain length of time. Now, you'll have an abdominal support garment like a big belt that you wrap around yourself, and that helps with the swelling and discomfort during surgery. So it's important to wear it for the recommended amount of time each day. I usually recommend it. You wear it as often as you can, as long as it's comfortable. Now, smoking and drinking alcohol can seriously mess up your recovery. So you've got to avoid these for at least 3 months after surgery. Okay, getting back to a normal life. Well, many of you have young children, and you want to enlist the help with child care because squatting or picking up children, or heavy objects for that matter, for the first few weeks is strongly advised against. But driving, cooking, and shopping is manageable after a week or two. Now, most people opt to take up about a month off of work for recovery, especially if you have a physically demanding job. And it's especially important to take plenty of time off so you don't jeopardize your recovery. You'll also want to avoid exercise during this time for the same reasons. Okay, what are the long-term effects? Well, some people experience numbness or a pulling sensation for months after a tummy tuck, and this is usually normal and fades with time. but it can take up to about 3 months for the swelling and bruising to go down completely. And it will take a year and sometimes 2 for your scar to completely fade. Now keep in mind, recovery is a process, and working closely with your plastic surgeon and surgery team to understand you prepare for your post-surgery life can help make your recovery seamless. A tummy tuck can be a wonderful way to achieve the aesthetic goals you have for yourself. Just remember, be kind to your body and focus on doing everything you can to recover fully from the procedure. Well, I hope this is helpful. If it is, check out my other videos. Be well and be healthy.